It's day 4 of the federal election, and while tariffs and the threat of U.S. annexation are top of mind for Canadians, so is our country's healthcare system. The Canadian Medical Association is hosting an upcoming health summit to discuss the impacts some of the health policies U.S. President Donald Trump is making and its impact it'll have on our medical system. Joining us now is President of the Canadian Medical Association, Dr. Joss Reimer. Good morning, Dr. Reimer.
Good morning. How are you?
I'm well. Thank you so much for joining us. Now, tell us about how some of U.S. President Donald Trump's health policy decisions are affecting us here.
Well, there's a lot of things that are affecting us based on what's going on in the U.S. because we know that these types of things don't respect borders. So the first thing I would actually say is that income is the #1 determinant of health. So as our income is being threatened with tariffs and with other issues around our relationship with the U.S. and other countries, that means our health is being threatened as well. And if our income goes down in Canada, we know that Canadians' health will be impacted as well. So even just talking about the economy is interlinked with health, and we need a healthcare system that is strong and ready to mitigate the impacts of this threat to our income now more than ever. But then on top of that, there's been policies where they've been cutting research budgets or changing what's allowed to be presented on the CDC website, which is a website that both Canadians and healthcare providers in Canada use regularly to.
Not only are they changing a lot of their policies based off of like what is shown on the CBC and stuff like that, but the tariffs are really impacting the health industries and the pharmaceuticals industries here in Canada. A lot of American drugs are first bought in Canada. I know somebody who is personally impacted by this. They work in pharmaceuticals in Canada, specifically in insulin. And they're trying to figure out a way to, work around that because they know how, life-threatening it is for, people not to get insulin, for the prices of insulin to spike when they're going from here to America. And that's something that, I don't really think a lot of people are thinking of when they think of tariffs. I think a lot of people are thinking of, the big major ones, which is, oil, food, aluminum, stuff like that. But a lot of, pharmaceuticals are also very heavily impacted by this as well.
Find reliable health information.
Not only that, but people like RFK Jr. normalizing being anti modern medicine is also vastly negatively impacting that as well.
So these types of decisions where now the information is either not present or not reliable is impacting our ability to provide care here in Canada as well.
Have you seen some of the medical research change the way we do business here so far?
Well, I've seen researchers lose their funding here in Canada. And so this is impacting the work that we're doing here in Canada because we have such an interlinked relationship with our counterparts in the US where we share research teams and research funding. And so this is something that we're going to feel throughout the country, but also something we're going to feel for decades because research is something that takes a long time. So cuts that we see today are going to impact the future cures that we might be able to find for cancer, for our long-term diseases. This is going to have impacts on Canadians, and really I want to see Canada step up and put health and healthcare at the forefront of this election because we know our health is going to be impacted and we need our federal government to make sure that health is a priority.
Okay, so tell us about this upcoming health summit and what's happening there.
Well, the Health Summit is sort of our big event that we have with the Canadian Medical Association where we invite physicians, medical learners, and patients to get together to talk about the health system and what our needs are. And so it's happening during the federal election. And we want to make sure that everyone who's asking for votes hears about how important health is to Canadians. And we're even...
Okay, I'm going to go blow my nose.
We're going to have a panel where we have Minister Asselguera will be there along with Minister Jones from Ontario and Premier Fury from Newfoundland, talking about things like how the U.S. policy is impacting Canada. So this is an opportunity for physicians, for patients, for medical learners to get together to talk about what works, what doesn't work, and then bring that information to our decision makers, and particularly right now, those people who are asking for our votes.
Can we talk a little bit about some of the doctors in the U.S.? Has there been any interest on them relocating here to Canada?
Well, I will say one of the most popular posts
talking about health and the Canadian medical system being impacted by the American health policies while I'm currently dying of allergies is quite ironic to me.
I ever put out on social media was me saying to a doctor in the US that we would welcome them here in Canada. That got more likes than I think I've gotten on anything else I've ever posted.
Okay, the leopard print radiation guard, never seen that before. Fucking living for it. She's fucking serving cunt. Oh my god. And I mean cunt in the gay way, not in the mean way.
So there's certainly a lot of interest out there. We're hearing from doctors who are feeling frustrated and wanting to find a space where they're more open to practice medicine without government interference. And so we are open to accepting US doctors. We want to make sure that Canada is a place where doctors can thrive and where Canadians can have access to those doctors. So if there's US doctors who want to come into Canada, we really want to chat and make sure that we're finding a space for them.
Yeah, that would be good for us too. Let's talk about the surge in measles cases in the U.S. We know in Ontario there are 440 cases. Why is this so concerning?
That's going to be in the next story that we listen to. And I hope that this lady, the doctor lady, talks about how, you know, people like RFK Jr. are spreading the type of rhetoric that is making measles cases worse in Canada too. Because, like I've said a few times today already, and I'm going to repeat myself again, a lot of people who are Canadian pay attention to American politics more than they do to Canadian politics. A lot of them watch American news more than they watch Canadian news. Or a lot of them get, sorry, I almost burped again. A lot of them get a lot of their news from American influencers. And a lot of the right wing rhetoric, we saw this with COVID, and now we're seeing it with measles and other anti vaxxer stuff, is spreading from America and coming up to Canada. And it's very detrimental. It's horrible. It's terrible. And I really hope that, you know, CTV, which is a little bit more right leaning than I like, actually goes into that.
Well, we had eliminated measles from Canada in 1998. So we had 25 years where we didn't really have measles in Canada other than the occasional one that came in through travel. That was a huge accomplishment that we've now undone. And measles is not a benign disease. It's not a minor issue. At best, it's very unpleasant to go through, and at worst, people get severely ill with long-term health consequences, and some people will die. And so this is something that is serious, because not only because of the health impacts, but also because it's completely preventable. If we have enough vaccination and our whole community is covered, measles can't spread, but that's not the case right now. And especially the impact that COVID had on the trust in vaccines because of all of the anti-vax rhetoric that we saw online and all of the misinformation, we've seen our vaccine.
Damn, they are going into it. Yes, bitch.
Rates go down, and just the fact that we got interrupted in our school-based vaccine programs. There's kids who just never got caught back up. So this is preventable. The vaccine is 97% effective, very, very effective. But if you're not protected and you are exposed to the virus, there's a 90% chance that you'll get it. That's how infectious it is. That 90% of susceptible people who are exposed will get infected. So we really want to get the message out there that this is preventable. We have a very good vaccine. And if everyone is vaccinated, then we're not going to be able to spread this in Canada, just like we had achieved in the 90s.
Dr. Reimer, thank you for your time today.
Thank you so much.
They didn't really go into talking about RFK Jr., but RFK Jr. has been insane in the membrane, a little Beastie Boys reference, when it comes to talking about measles. Like, he is one of the top 12 anti-vaxxers. This is something that is like basically common knowledge. It should be. And he has been, you know, downplaying the measles epidemic that's happening in the United States, specifically in places like Texas, where it's really extremely bad right now, because a majority of the population just like is refusing to vaccinate their kids, and it's just getting so terrible. He's going up into Congress and telling them that, oh, you know, it's not that bad to get measles, and everybody when I was younger used to get measles. And it's like, okay, you're the same age as my grandparents, or maybe even my great grandparents. I don't even know how the fuck old he is. I think he's in his 70s. Yeah, so he's like my grandparents' age. And it's like, sir, just because you're just because you're think you're fine with it because you have survivor's bias doesn't mean that it is okay. Like, children are dying. Hey there, thoughts on the election coming up? Besides any polls, any personal thoughts on the candidates? Ooh, good question, Swagmaster. Um, I honestly, I think Pierre needs to stop trying to act tough and push back against the liberals. And I think he needs to focus more on denouncing Trump and talking more about like what's going on with the tariffs and stuff. I think a lot of people are more focused on that than their hatred of the Liberal Party right now. I think that the liberals need to focus more on the cost of living and not trying to meet conservative tax cuts. I don't think tax cuts are going to give people more money. I think tax cuts are just going to feel like a bandage on the cost of living crisis, and a lot of people are still going to feel the impact of that. And when it comes to the NDP party, I definitely do favor the NDPs more than the other two parties that I just talked about. But I do really think that Jimmy Singh is kind of slacking right now, and I think that he needs to take how low he is in the polls a lot more seriously. Like, I was just talking about the polls earlier, and in Quebec especially, which is one province that I was just talking about not too long ago, they're only at 6.3%. That is the lowest they are out of all of them. The next being Atlantic Canada, which is like New Brunswick, Nova Scotia, and PEI, and Newfoundland. And then the next lowest after that is Ontario. And I really think that he needs to be taking not only like the landlord stuff more seriously, because he does talk about it, but I just don't think he's as aggressive as he should be on it. But I really think he needs to focus more on, very similarly to what I was saying with Pierre, more on Trump, more on, hey, we're going to be fighting for you. He has been talking about cost of living stuff, which does impact a lot more people than just like the tax cuts would. But I really think he needs to start playing hardball, or the NDP party might end up in the same position as the Green Party and might not even really qualify next time around, if you catch my drift. And when it comes to the block, um, they're doing a lot better than Pierre, or not Pierre, fuck, than the NDP in Quebec, which, yeah, is to be expected, but they're also kind of struggling against the liberals, and a lot of that has to do with, again, Trump. And I think a lot of the candidates just need to focus on, focusing on our sovereignty and trying to make people more comfortable when it comes to that. Um, Besides that, I'm really just hoping that, besides the polls, besides the candidates themselves, I really just hope that more people just go out and vote and talk about politics and actually, talk to their friends and their family about politics, even though I know it's extremely uncomfortable to talk to people in real life about politics. I really think more people should. I genuinely don't care what party you're going to be voting for, liberal, NDP, conservative, even. Just go out and talk to more people. Voter apathy is something that is really, 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 really fucking us over. I'm in Ontario, and the last two elections, especially provincially, we have had the lowest voter turnouts. And because of that, Doug Ford has been just coasting by. And I worry that because Ontario itself is a, a very big contributor to who's going to win in a federal election, I think that a low voter turnout is something that is going to really, really, really impact the federal election. Oh my God, you did a really long message. Okay. I feel like Trudeau was honestly an easy target for Pierre. Agreed. He has he's was just unpopular across the board. Agreed. I feel a lot of voters weren't necessarily conservative as they were anti-Trudeau. I also agree with that as well. On the conservative side, Pierre is the debate will be um, vital for them. I feel like if Pierre leans too much into woke mind virus thing or attacks on Carney, I feel liberals will eat him alive. I also kind of agree with that too. I really think he needs to stop focusing on trying to treat Carney like he's Trudeau, and I think he really needs to, read the room and start focusing on actually being Canada first, because trying to focus really hard on the liberals and attacking the liberals is doing fucking nothing for them. Like, let me just move this here. Like, look at that. Like, he used to have such a huge lead over the liberals, and he didn't even move within the last 24 hours when it comes to the polls. This is where he was yesterday, and the liberals have gone up, mind you, only by 0.04, but the liberals are going up higher than Pierre is. So I'm very much in the same line of thinking as you are when it comes to that. Oh no. Sorry, my computer's a little funky. And like if we go here, let's scroll down more. This is where he was when Trudeau was still kind of in power right before or right when Trudeau left. And now here's where they are. He went down almost 10 fucking percent. Like he needs to really refocus on what he is doing, because sticking to the now beaten to all hell dead horse is just not working for him at all. And if anything, I really think it's also contributing to the liberals doing way better. On the NDP side, I think they to need a complete overhaul of leadership. Singh is no Leighton or Douglas or Bart or Borbent. Sorry, I just don't think he's very personable at this point. I can agree with a lot of those points. I think a lot of what the problem is when it comes to the NDP too is that they're way too closely associated with the Liberal Party, and a lot of the good things that Jagmeet Singh did do when it came to policies and stuff and pushing the Liberals to do like pharmacare and dental care and the daycare stuff has really been overshadowed by the Liberal Party, and he's got a lot of that like Trudeau stink on him, like without having a better way of saying it. And I think that like because of that and because of how closely associated he is with the Liberal Party, that's definitely going to have a really huge impact on how the general public perceives him for sure. Same with like, in my opinion, again, not being as forward and aggressive when it comes to the points that he's making and the policies that he's advertising, because like when he's talking about fighting landlords, he's really just doing it as like a point at Carney. Like the last question period thing that he had, or like last like what's the word I'm looking for, like press briefing, sorry, that he had, where he was just like in the little library area, he was focusing so much on the investment group that Mark Carney worked for when he was talking about landlords, and not so much like landlords as a whole or corporate landlords as a whole. And I think that's something that like die hard NDP supporters are going to hear and are going to focus on, and they're not going to be really happy about. And I really think that if he's not going to, like, if they're not going to, do a huge overhaul, I really think he needs to rethink how he's talking to his base. The NDP just needs to return to the old policies of fuck the liberals and fuck the conservatives. We're the true third option. Heading into the next election cycle, I believe if they head to more radical direction, they'll work out. I agree with that, honestly. Less appealing to the center, more rent control and nationalism Well, I don't know much about like the nationalism part. Personally, I'm not a huge fan of that, but I do think that like if they had a more radical approach, that would definitely do a lot better for them. And I think rent control is a huge thing. I think fighting landlords is a really big thing. But oh, sorry. Yeah, sorry. I'm dyslexic. I read that wrong. Nationalization. Thank you. I read that so wrong. I'm sorry. But yeah, I really think that that is definitely something that like they do need to work on, and like making more things public too. Like a lot of candidates are focusing way too much on privatization, and I think that if we had a more true left leader in the NDP party, that would definitely help out, or more actually left leaning policies rather than, like you said, ones that appeal more to the center. And honestly, ones that are more aggressive too. Because, like, my mom fights landlords for a living. Like, that's what she does. She's tries to keep people in their rented properties. She sometimes, the very odd occasion, kicks helps a landlord kick somebody out, but it's primarily she helps people stay where they are. And landlords are way too emboldened right now. Majority of our government is run by landlords. Almost every MP is a landlord, and Jagmeet Singh, or I should say, every conservative and liberal MP are landlords. There's only a sprinkling of like NDP and Green in between, but even Jagmeet Singh, his wife is a landlord. So landlords aren't going to regulate other landlords. They're going to do everything that they can possible to make the market more favorable to landlords rather than turning the tides and making everything more affordable and more favorable to tenants, and make more protections and regulations that favor tenants. So I really think that they need, either Jugme needs to turn around and become more aggressive about landlords, or they need somebody who is actually going to do that as well. Because we aren't ever going to get out of the financial crisis or the cost of living crisis or the housing crisis if we continue catering to landlords versus the workers and people who actually need it. Kearney and Polyev feels like two sides of the same coin. I agree, which doesn't help. There is too little of a difference between the two. I'd think Singh would bite on this, but they haven't. They really haven't, and I agree with that too. Not only that, but like I said, he's focusing too much on personal attacks instead of differing himself from the two other parties too, which I think really does also kind of contribute to why people aren't really, favorable of him, why his policies seem very wishy-washy, and I so agree with that too. I am going to put on the measles video though, because I do want to get through that.
It's Tuesday.
And then I think, just to kind of keep on track with like what I've been talking about, I think I am going to skip all of the stuff that has to do with the group chat incident and Trump. And then I'm going to skip down to the last video that I was going to watch. I'm even going to skip the other voters video that I really want to watch. I'm probably going to put that on tomorrow. And a lot of these ones I'm probably going to talk about tomorrow, but I really wanted to talk about the Israel airstrikes today as well. On landlords, fuck them. I wonder how a slow policy of decommodification, I can't read today, housing would work. Yeah, that would be really interesting. That's definitely something that like my mom and her colleagues and the MP that she works with talk a lot about, because a huge focus on commodification of housing, and a lot of people using housing as a honeypot for retirement and for savings and stuff, and contributing to the hoarding of housing, and the lack of housing that's available for people to rent or buy is a huge part of why people are saying that we need to add more supply when we do physically have enough houses in this country to home everybody. But landlords and small time landlords and small-time investors and big corporate investors are just getting way too in the fucking way. Anyways, I gotta go get going. Your next game is on at 15. I can't wait to feel the pain. See ya. Have a good day. Yeah, it was good chatting with you. I love that. I love bashing landlords. I don't normally get to do that on here.
Morning in that sort of 7:20-ish time slot, and joining us live as he does almost every week is Dr. Isaac Bogosh, infectious diseases specialist at Toronto General Hospital. Good to see you this morning, Dr. Bogosh. Of course, you know, we've talked a lot about measles in recent weeks. I mean, a lot. And that's because there have been a lot of cases in Ontario specifically. And of course, the public health data shows that the spike we're seeing and that you told us wasn't going to slow down. A lot of this, though, really goes back to people's vaccination status, doesn't it?
Mm-hmm.
It absolutely does. And when you look at the data for Ontario and basically anywhere else in the world, you see that this is largely an infection in non-immune people. In Canada, if you were born before 1970, it's very, very likely that you had this infection and recovered from it and are given, immunity. But those born after 1970 should be vaccinated, and that's when routine vaccine programs were initiated. And
and that's the thing that people, going back to talking about RFK Jr. being so pro nobody vaccinating their kids and thinking that measles isn't too bad and people just need to get the infection, is that people older than fucking older than RFK Jr., they don't have the same immunity that people who are older do to measles. And I would even argue that people who are older nowadays even might have a slightly lessened immunity to it too, just because of how, like the first doctor said, how far in between it's been since a lot of people have been exposed to measles, because in Canada it was basically fully eradicated in 1998, like the first doctor, I think her name was Ross something, said. And that's something that, like, people who, again, like I said prior, who have survivor's guilt kind of fall into, right? Like, there are a lot of people out there who think, oh, well, I had it and it wasn't too bad, or oh, I know this person who survived it and it wasn't too bad, or oh, back in my day we got it and it wasn't too bad. That's survivor's bias. That's, you thinking that because you made it this time doesn't mean you won't make it the next time, or that somebody else who has a completely different immune system to you will be fine, even though, again, they have a completely different immune system, a completely different set of DNA that contributes to how their immune system reacts to shit, how the rest of their body will react to shit. You know what I mean? And a lot of people, like RFK Jr., just can't think outside of themselves. And that is a huge contributor to why a lot of these people who think a lot like RFK Jr. are just so incredibly willing to let other people suffer. Oh no, I dropped my steam ripper. To let a lot of other people suffer and die, and a lot of other children die, because they're too confident in their ignorance and their survivor's bias that they can't think outside of it. And it really sucks that somebody like that is now in a position of authority in America when it comes to healthcare. And because, like I said before, because it all kind of ties in together, because a lot of people in Canada, oh, I burped again. Sorry, I need to stop drinking pop. I never really used to drink pop, but now I've been drinking it a lot more, and it's been like murdering me. Anyways, so because a lot of people consume a lot of American media, they consume a lot of American content creators, they consume a lot of American news, they're just like falling for this like honey trap of just not getting vaccinated, because they're hearing all of these conservative right-wing Americans like Joe Rogan and RFK Jr. peddle all this misinformation, and it's just poisoning the brains of Canadians. Yeah, measles wasn't a thing in Canada for the longest time till the anti-vax movement, but how would a mother and father feel if their daughter/son died of measles because they were ignorant to get their kids vaccinated? Well, I don't know if you've heard of that story in the States, but there was one woman and man who did do that, and their kid wasn't vaccinated. And they said that measles still wasn't that bad, even though their, I believe, daughter actually physically passed away from it. So I would hope a lot more families would feel more remorseful and they would learn from that happening and would not want it to happen to their other children. But there is a very famous example of that happening in America, and the parents just being so incredibly stubborn and so incredibly willing to believe rather than sit with the consequences of their kid not being vaccinated, that they're still believing the anti-vaxxer bullshit. And it is absolutely insane. And yeah, it wasn't really a thing in Canada for the longest fucking time. And the anti-vax movement has brought it back. It's very, 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 very disturbing how much, the anti-vaxxers during COVID and the anti-maskers during COVID, a lot of them getting their information from American right wing media, has created this like vast network of anti-vaxxers now in Canada that are literally going to be poisoning and killing our children. Like, I actually had I don't know what you're talking about, but your curls look amazing. Oh, thank you. I'm talking about Canadian politics and the election, and currently the rise in measles in Ontario, like Canadian news. But yeah, I had a friend who I recently had to stop talking to because she started going down that same pipeline. Like she was trying to convince me that uh, on one hand, pharmaceuticals are bad, but then on the other hand, I should be taking insulin as somebody who is not diabetic to cure my ADHD, and was saying a lot of anti-vaxxer stuff. And she was a very rational person. Like, this whole like I don't want to call it mind virus, but this whole like very very toxic mindset that a lot of people have fallen into since COVID, mostly based off of fear, and I can recognize that, is something that has genuinely torn families and friendships and other people apart, and it just makes me so worried for the future, like so incredibly worried for the future.
We really do see the overwhelming majority of cases of measles in unvaccinated individuals or in individuals that have received only one, not two, of the doses of vaccines.
Absolutely. Okay, I know we got some boards we're going to get to sort of showing and reflecting the data you're talking about there, Dr. Bogosh. But also, we should point out measles was considered eradicated not that long ago here, and that can be attributed to the vaccine. I want to bring up another chart, not this one, but we'll get to it in a second here, which shows our viewers this morning. And while it may seem self-explanatory, it's the next chart here, folks. It really shows us kind of the impact of vaccines on measles and the illness here.
Right. The one that we're looking at right now is just looking at okay, let's go talk about this one. This one is sort of, we talked about a second ago. Each bar represents an age group. So you can see the bar on the far left is those under 1. The bar at the very far left are those over the age of 40. So those are the age cohorts. And that sort of pinky orangey color in the middle are non-immunized individuals. So you can see the vast majority of cases in Ontario, this is the Ontario outbreak, are in non-immunized individuals at all age groups. And yes, of course, is the vaccine 100% perfect 100% of the time? No, nothing is. And that's why you see some little bits of blue in there. Those are people who have received 2 doses of the vaccine. That is the vast, vast minority of individuals with measles vaccines. This just shows you that this is truly an infection that is impacting those who are not immune to this virus. And this one that we showed briefly, that just shows the current epidemic. So those are the number of cases over time, and you can see the various the timeline on the bottom, and the confirmed and probable cases. So maybe it's slowing down a little bit. That would be wonderful news. This is an impressive chart here. You can see how on the far left, there's lots and lots of measles cases identified. And then in 1963, when the measles vaccine came out, we saw a tremendous drop in cases. Then you see a little bit farther along, routine childhood immunizations. 1 dose of the MMR vaccine was given. and you can see a further drop in cases. And then it's almost a flat line in 1996 when routine childhood immunizations were 2 doses of the MMR vaccine, with a few little bumps here and there.
Yeah.
But in general, this vaccine essentially eliminated the virus from the country and is so effective. This is Canadian data. It is so effective. And when we take our foot off the gas pedal and we see slipping vaccine rates, especially in pockets and communities, those are vulnerable to infection. And right now we're watching this virus exploit those pockets because it's so transmissible. It gets in there, and unfortunately people get infected with this.
Okay, so I appreciate you walking us through those charts, Dr. Bogosh. Let's also talk about this out because this ties into vaccinations as well. Dr. Kieran Moore, a name that I haven't said for a couple of years, I feel like now, Ontario's Chief Medical Officer of Health, that people have forgotten. He's now adjusting the recommended timelines of when infants should be getting the measles vaccine because of the seriousness here.
Right. So normally the first dose of the vaccine is given at 1 year. And the second dose of the vaccine is given, at around 18 months or sometime before a child enters,
oh my God.
School.
I thought the mouse or the, like the little mouse, like arrow thingy was mine, but it's black and it's not mine. Sorry, that just caught me off guard.
But in the hard-hit areas in Ontario, in southern Ontario, there's a few areas where the recommendation is that the first dose of the vaccine can be given at 6 months to 1 year. And I think that's important because children, the youngest, are the most vulnerable to this. We know that those under 1 year aren't immune to this. They don't have, with the prior recommendations, they're not eligible for vaccinations.
I genuinely just don't understand. I mean, I obviously, I mean, I do. I was saying it earlier, but just like from like an emotional standpoint, I can't relate to people who wouldn't want to do everything in their power to make sure that their children are safe. You know what I mean? Like it's just so scary to me that there are people out there who are just okay with gambling with their children's lives.
A level of protection to a very vulnerable group. And again, that's not for all of Ontario. Those are for the regions in southern Ontario that are impacted by this. And of course, like anything else, public health changes as data changes. So I wouldn't be surprised if Dr. Moore updates this at some point as we see this progress, either as it fizzles out or unfortunately if it gets worse. But that's the current recommendation now. So some people in those hard hit areas where we see most of those cases can vaccinate at 6 months to 1 year rather than just at 1 year.
All right. Appreciate you walking us through all that data this morning. Dr. Isaac Bogosh, as always, appreciate the time and insight. Talk to you soon.
My pleasure. Thank you.
Yep. Gotta love that. All right. So we're moving on from measles and from talking about the Canadian election, even though I really wanted to get to this voter one here because I really wanted to focus on a lot more like general voters' opinions today, but it's getting close to when I was supposed to be making dinner. So I'm going to be skipping to the very last video on my playlist here. Everything else is going to be transferred to tomorrow in between videos, obviously updating about the election and stuff. So I'm just going to go to this global news video about Israel's airstrikes on Palestine. Ooh, actually, I think a lot of this is going to be TOS. So I'm going to cover it up while it's playing until it's okay. Obviously, nothing there was like shown, but I just don't want to, for obvious reasons. And for those who can't see it, because my lovely face is covering it, Israel strikes across the Gaza Strip, unalived at least 23 Palestinians on Tuesday, local health officials said. And I like that they're saying local health officials, unlike what American news organizations are usually saying, where they call it like Hamas Health Organization. The Israel military resumed its campaign against Hamas in Gaza a week ago shattering a 2-month ceasefire. And you guys can't see it, but there are 4 gentlemen who are helping carrying away a very limp man. I'm hoping he is okay. I mean, obviously he's not physically okay, but I'm hoping he is still with us, type of thing. He does seem to be okay, though. His head is up. Since then, nearly 700 people, mostly women and children, and over 50,000 people in nearly 18 months have been unalived. Palestinian health officials say. And I think I can show this because it's not too bad. There's no blood. We can see this building has been demolished. There's been people helping a lot of these other people out. If anything pops up that is not to TOS, I will be switching it out, obviously. You can see people helping each other and going over rubble. Here we can see just destruction everywhere. Lots of clothes. I'm not seeing anything that's not TOS though, so this is okay to show. My nephew was around 15 or 16 years old. Mahmoud Moshe. I hope I pronounced that right. Sorry. Happy and showing us, saying, "Look, uncle, he's happy," and the little ones. We have Fatna, who is 4 years old. I hope I said that correctly. And we have Hala, around 11 years old. Fotna is how you pronounced it. Fotna. They are all children and women who passed away. There are no targets for Israel. There are no targets for the Israel occupation. The targets are children and women. Okay, this is not TOS. Enough destruction, enough killing. We have horrific injuries in the hospitals. Go and see. Enough. My message to the world is enough. Look with mercy at Gaza. This doesn't really have TOS on it, so I'm gonna go back. You can't really see anything, but I'm sure with the visuals of a ambulance that could be triggering to somebody. Okay, now we're looking back at that same building that was shown before with the side of it completely opened where we were in the beginning. And now we are showing more white bags, if you catch my drift. More people, I should say. Suddenly, he was gone. I got the news in the morning that they bombed my brother's house. He did not know what was happening. Those who were thrown on the roof and the children who were thrown. She means by the blast, obviously. A child who is an orphan, he was thrown on the neighbor's roof. We don't know how under the rubble. There was a girl waving with her hand. Help me, I'm alive. And my daughter was martyred. بنت اللي استشهدت. Devastating. Absolutely devastating. So, unfortunately, that is going to be it for me tonight. I really wanted to end it on the 23 people taken, at least 23 people taken by airstrikes by Israel on Palestinians across the Gaza Strip. I haven't really talked too much about it recently, but with the ceasefire being broken by the Israel government, I really think it's important to bring it up, especially since a lot of our government is contributing to what's happening in Gaza, and a lot of the American government is contributing to what's happening in Gaza. And I know I skipped a lot of important stuff for the election here in Canada, but I really just wanted to focus on the last thing being about the airstrikes and everything else that's going on there. I know I had to cover up a lot of it on Twitch with my face because a lot of it was not TOS, but again, I really just wanted to make sure that I talked about that. I don't know what you're talking about, but that's something the other person already said. But yeah, so that's gonna be it for me for tonight. I'm gonna go make dinner now, and I hope that everybody can, at least like if you're gonna take anything away from the almost 4 hours that I've been on because I started a little late today, that you take the measles stuff with you, of course, but you really take the just human loss and impact that is happening in Gaza right now, because it is absolutely insane that there are still people out there who are denying what's going on over there. And I know that, as somebody who's a lover of history, that this is going to be something that we all look back on and wonder how people could, just like completely dismiss so many innocent people and watch so many children and so many people just like, be snuffed away for nothing besides just the ego of one man and the continued, just the continued genocide of the Palestinians. And it's really heavy and it's really terrible. And I hope that people take that and they think a little bit more about what's going on over there. And yeah, that's it for me, guys. I'm gonna go to make dinner now.